This is a group presentation as presented on tobacco cessation. So this presentation is presented by Peyton, Elizabeth, Henry, and Daniel. So we'll start with discussing about health effects of tobacco. And we'll also talk about three health promotion programs on tobacco cessation. According to the American Cancer Society, tobacco use remains the leading preventable cause of death in the US. It leads to about 1 in 5 deaths each year. On average, smokers die about 10 years earlier when compared to non-smokers. More than 16 million Americans are living with a disease caused by smoking, and for every person who dies because of smoking, at least 30 people live with a serious illness caused by smoking-related smoking. Some of the illnesses caused by smoking include non-small cell squamous cancer of the lung, esophageal cancer. It can also lead to heart diseases, stroke, diabetes, chronic obstructive pulmonary disease, and increased risks for tuberculosis, glaucoma, and certain autoimmune diseases like rheumatoid arthritis. Smoking causes about 20% of all cancers and about 30% of all cancer deaths in US. About 80% of lung cancer, as well as 80% of all lung cancer deaths, are due to smoking. And it's the most common cause of cancer death in both men and women. Secondhand smoke exposure contributes to approximately 41,000 deaths among non-smoking adults and 4,000 deaths in infants each year. We'll also talk about what makes a good tobacco cessation program. So a good tobacco cessation program should have facilitating factor, and this means focusing on increasing or supporting healthy behaviors, perceived power, which is factors that support the desirable strength which individuals perceive as adopting of health behaviors. It should also have a continuity of cessation themes throughout the year, community support, which demonstrate value in good health within the community. It should also have public policy support. So that's translating community values into laws, regulations, and policy. So in this presentation, we'll try to discuss about two theories that will help us explaining the tobacco cessation programs we've picked for ourselves. And this we'll start with theory of reason action and theory of planned behavior. So this theory suggests that an individual's behavior is determined by their intention to perform the behavior, and that this intention is in turn a function of their attitude towards the behavior and subjective norms. This theory consists of three components, which includes attitudes, subjective norms, and perceived behavioral control. The second theory we'll be looking at is our ecological model. And this is a health model that highlights the relationships between multiple determinants affecting health and the development of health intervention. Core concepts of this theory include individual, interpersonal, organizational, community, and public policy. So I would like to hand over to Peyton.
All right, and I am going to be talking about our first example, which is our poor example. This is You Can Quit Too. It is an app that was created by the US military to help encourage military personnel to quit smoking. Some important things to think about when talking about smoking in the military is that smoking is a very large cultural part of being in the military. 15% of Department of Defense personnel started smoking after joining the military, and 30% of current smokers reported that they started smoking after joining the military. When looking at that, the other thing that is important to look at is that military guidelines regarding tobacco cessation programs, as well as all other regulations in general, are not only dependent on the branch of military that you're in, but on the location. When looking through the regulations, two from the Army stood out, specifically from the Womack Medical Center, lists that smokers and non-smokers could potentially be living in the same space, and there is no regulation against smoking in their bunk rooms. So if a non-smoker wants to leave, they have to request to leave the room if they're partnered with a smoker. The other thing that really stands out is in regards to actual smoking cessation programs, where it talks about how they only get one program that they pay for. And then the doctors will go and they will take a look and see if they are eligible for medication intervention therapies. And after that, anything else in regards to group therapies or any other programs are on the individual themselves and not assessed with the military themselves. So looking at the models to compare, you can see that there's a lack of social and economic policies in place, as well as institutionally, there is a lack of consistent rules and regulations to prevent smoking. And then socially, there is a very strong social tie between smoking and the military. And so when you use the theory of planned behavior to look at this, you see that there are subjective norms that are in favor of smoking, and that there's a low perceived behavioral control over smoking. The app was created that it attempts to increase that, but it's only targeted at the individual. And it has been proven that smoking cessation programs are more effective when used in group and individual treatments, and they should be used together. And I'm going to pass it off to Elizabeth.
Yes, thank you. My name is Elizabeth. I will be presenting the average article, Health Communication Campaign. In February of 2008, Mexico City had established a comprehensive smoke-free law in enclosed public places. This law was a critical component in the WHO's Framework Convention on Tobacco Control. Mexico was one of the first countries to put a law and accompanying campaigns to help lessen or quit smoking. The marketing campaigns, Aire sin humo es vida and Se respira respeto, served as a successful component to advertise and ensure citizens understood the parameters of the law, as well as successfully influencing the attitudes citizens has towards the danger of smoking. In one evaluation, smoking trends were noted to have decreased by about 11%, with a majority of those between 2002 and 2009. Yet it was found it was largely due to increase in taxes. In 2018, it was noticed that intense and well-designed mass media campaigns are just one part to help counter the tobacco industry's own marketing. It is also found to fully implement the WHO's framework, mass media campaigns are but just one part of the equation, and it needs to be sustained in its messaging, funding, and delivery. Now, within this article and this campaign, the ecological model demonstrates that the campaign is more at the policy and organizational levels, yet it is at the individual level where this health communication is well targeted. It lends itself to the theory of planned behavior, demonstrating increasing attitudes towards positive behaviors and exploring personal reasons to change. To sustain these planned behaviors, social media marketing would need to be longer than the 3 months of the original campaign. And a practical implementation would be a social marketing media campaign that creates automated messages, increased by user engagement, and giving more autonomy towards the messaging. And so at this time, I'm going to go ahead, hand the microphone over to Daniel.
Hello, my name is Daniel Woke, and I'll be talking about the TIPS campaign, which is an example of an excellent campaign. Now, the TIPS campaign was actually introduced in 2012 by the Centers for Disease Control and Prevention, and the TIPS campaign actually profiles real people who are living with serious long-term health effects from smoking and secondhand smoke exposure. Primarily, the audience here included people within the ages of 18 through 24, and the TIPS campaign is based on an in-depth review of research conducted in multiple US states and other countries, as well as extensive campaign development, research, and testing. And people who smoke was found out that people who smoke told that they needed to see and hear what it would be like to have to live with the health consequences of smoking. And for decades, people who smoke had heard that smoking would ultimately kill them, but that wasn't the motivation they needed. The nicotine in cigarettes is so addictive, they said, that even the fear of death wouldn't motivate them to quit. And people who smoke said that seeing how smoking could affect their lives and impact their families was the only true way they could be motivated to quit. The TIPS campaign goals were to build public awareness of the immediate damage caused by smoking and exposure to secondhand smoke. And at the end, the TIPS campaign was able to the CDC estimated that more than 16.4 million people who smoke have attempted to quit, and approximately 1 million have successfully quit because of the TIPS campaign. Now, applying the theory of planned behavior to the TIPS campaign, the motivational factors that influence a person's behavior, where the stronger the intention to perform the behavior, are more likely than the behavior to be performed. And as such, the stories shared at the TIPS campaign encouraged the recruits to consider changing their smoking behaviors with perception of behavioral changes in their own best interest. And relating this campaign to the ecological model, we found out that the interaction between the individuals who shared their stories with other people can actually provide support or create interpersonal growth that promotes quitting smoking for good. And at this, we'll be concluding the presentation. Thank you.